So I'm a communications person at heart. I don't get nervous about public speaking, but I'm going to do something today that I am a little bit nervous about, which is sharing my personal story. For people who know me, I don't like to talk about myself. I'm very happy to talk about the work. I don't like to center myself. But part of the reason why I care so much about reproductive freedom is that I'm a mom. I have an 11-year-old daughter who is funny and hilarious and who is also 11, so anyone who has a middle schooler knows it's like one day you have this teeny tiny infant and then the next day you have a middle schooler and they don't want to talk to you and they slam doors and do all of that kind of stuff. So that's where I'm at in my parenting journey. But when I was pregnant, I had a vision for how I wanted my birth to be. I wanted a natural birth. I was a little bit nervous, and so I wanted to be in a hospital setting just in case anything went wrong. And part of the reason I think that I have not shared a lot about my story publicly was because I just had an embarrassment of privilege while I was pregnant. I had health insurance. My husband was actually working for the federal government at the time, so we had like one of the Cadillac healthcare plans and had very little out-of-pocket cost for our daughter's birth. I was married, I was gainfully employed, I was working here at the University of Louisville, I had a supportive employer, I knew I was going to have childcare here on campus after my daughter was born. All of the things that everyone should have when they're preparing to welcome a child into the world. So I went to the hospital at 41 weeks. I never let my daughter never forgive her for that extra week, past 40 weeks. But at 41 weeks, I went into labor. I was in labor for about 25 hours, unmedicated labor, and she wasn't moving down. And so it got to the point where her heart rate was dipping as my contractions were coming, and we were having conversations, and we waited a couple hours, and we weren't getting progress. And we said, okay, we're going to have to do a C-section. So I had a lot of disappointment because I had, planned for all of these weeks and all of my practice was for a natural birth. But of course, I really just wanted a healthy baby. My C-section happened. My daughter was born. She had an extra long umbilical cord. I never knew that was a thing that had wrapped around her shoulder, and that's why she wasn't coming down the birth canal. But she was born. She was healthy, and I was struggling. I had not prepared for a C-section. I'm a person that likes to be prepared. I like to know what's going to happen next. And so I was struggling through sort of, I can't get out of bed for 24 hours. I have these strange things on my legs that are making sure that my blood circulates. All of these sort of unknown things that were happening. So I was processing all of that. I was learning how to nurse. We had people coming in and out and visiting, all of the emotions that happen immediately after you give birth. And so that first night after she was born, we sent her to the nursery for a few hours. My husband was staying in my room with me. And we thought, okay, we're going to get some rest just for a few hours before they bring her back, before she wants to nurse again. And at some point during the night, a nurse woke me up and gave me a little cup with pills, told me to take some pain medication. I went back to sleep. The next thing I remembered, it was the next morning, my husband was at my bedside, very concerned, very wide-eyed. As soon as I woke up, he was asking me if I was okay, and he was pressing the button to call the nurse, and I was very confused. Harper was back in the room. She was sleeping peacefully, and he was asking how I was feeling, and of course, I've been pregnant for 41 weeks. I've been in labor for 25 hours unmedicated. I've had a major surgery, and I was like, I feel like a train ran over me. I don't know how I'm supposed to go right now. I don't feel great. What's going on? The nurse came into the room, and he was like, I didn't sleep all night. He was like, you were thrashing around. You were talking out of your head. You were incoherent. I couldn't wake you up. I called the nurse. And it turned out that dose of medication that I was given overnight was actually an overdose. The night nurse mistakenly brought me a dosage of pain medication that I wasn't supposed to receive at that time, and at an amount that was above what had been prescribed for me. And so I panicked for a lot of reasons. I was nursing, and so I immediately had questions as to what I'd been given. Was it going to cross with my milk? Was it going to impact my ability to nurse? And I come from a family with people that have substance use disorder. And I know the stories of how substance use disorders begin. They often begin with an injury, with an accident, and people are given pain medications and become dependent, and it turns into a disorder. And so I was very nervous that this door had been opened for me. The nurse and everyone was checking me out, and everything seemed okay. I was asking all of the questions I was asking about what I had been given and how much and all of those things. My husband was very scared. He was like, I haven't seen you like that before. I couldn't wake you up. And at the time, one of the comments from the hospital staff that was made was, well, she's had a rough few hours. She's feeling really good right now. She'll be okay at the moment. So we left the hospital. We didn't have any more issues with medication while we were there. But when we came home and I'd received the prescription for pain medications, I immediately handed them to my husband, or when my mom was caring for me, I made sure that my mom had them because I was just deathly afraid. I was really afraid that I was going to take them at the wrong time. I was really afraid because of what happened. Maybe I was going to become dependent. And so in those first few days that we were home, those first precious days of nursing and cuddling and meeting this new person and becoming a family and welcoming families and friends, it was always in the back of my mind, what is going to happen? I was so nervous that at times I didn't follow instructions from my doctor, didn't follow the instructions for pain medication, and let my pain get out of control and get to levels that it shouldn't have been because I was so afraid to take the medication. Now, my story has a happy ending in that I didn't become dependent. I was able to recover. I don't have any long-term implications from delivery, and as I said, I have a happy and healthy 11-year-old that I was able to nurse for a year, which was my goal. But I think that the experience taught me a lot. And while I feel lucky that I came out of that situation and I haven't shared that story a lot, is because through this work, I've heard many stories. I hear the stories of people who don't have access to medical care at all. I hear the stories of people who don't have access to insurance, who want access to abortion, who aren't able to get it. And in the ways that sometimes I pull myself back and don't want to center myself, I've told myself over the years at different times that this story is not important. But it is an important story, because I think that one of the things it demonstrates is that no matter how much support you have, no matter how much health insurance you have, no matter how smart you are, no matter how much you have planned, if you are a person who looks like me, who goes into a hospital setting to give birth, you are predetermined to statistically have a negative outcome. And we just know that to be a fact. So when I think about the ACLU of Kentucky's Reproductive Freedom Project and the important work that we do, one of the aspects of that is addressing racism in healthcare. And you all have all these beautiful purple cards on the table, which I'm just realizing match my outfit a little bit. That wasn't planned. But on those cards, you see a couple of QR codes. At the top is a QR code for our Reproductive Freedom Project, which talks about the work that we do. We want to address racism in healthcare. We, of course, want to reduce the abysmal rates of maternal mortality, infant mortality here in the Commonwealth. We, of course, want to restore access to abortion. Kentucky is, of course, a pregnancy state. And so I think that it's important that we use that language about being a forced pregnancy state and not just say things simply as there's no access to abortion care. Because what is happening in this Commonwealth is that there are people who are pregnant that our government officials are forcing to remain pregnant against their will.
That's right.
And if these folks don't want to remain pregnant, the government of Kentucky is forcing them to flee their homes in order to access care. And we know all of the challenges that come with that. So I'm really proud of Jackie's work, of Heather Ayer's work, the work that we do at the ACLU of Kentucky to find a place to create a commonwealth where we have reproductive freedom. You can scan that first QR code and it takes you to a website which I believe gives information about how you can volunteer and how you can show up, come to the Capitol, talk to folks in your community and provide those tools. So I encourage folks to scan that. The second QR code you see on that card is related to our work to restore abortion access in the Commonwealth. So folks know that when Roe fell, 2 abortion bans went into effect here in Kentucky immediately. We at the ACLU and our partners at Planned Parenthood, we challenged those bans in state court. We were able to temporarily get access restored. And then we went through the court system and went to the Kentucky State Supreme Court, who said, we're going to dismiss this case. Doctors cannot bring this challenge on behalf of their patients, which is really something fairly unprecedented within the law. Hisses and hisses for the Kentucky Supreme Court. So what the court has told us is if we want to see the abortion bans in Kentucky fall, there has to be a patient plaintiff who brings this challenge to the court. Now, as we've talked about, we are in a forced pregnancy state. So if you are pregnant in Kentucky and you don't want to be pregnant, as you're trying to plan where you're going to go, which isn't going to be the state of Indiana, which also has abort right? So as you're making plans on where am I going to go, what am I going to do, how am I going to find childcare, how am I going to take time off work, the court and the government is also saying, you also have to be the person who has to bring this challenge and bring a major lawsuit in the state of Kentucky. It is a very, very tall ask. I know that person or persons is out there. We've been working for several months to identify them. The second QR code that's on your card is a QR code that leads to a legal hotline that is open where people can call or text in order to let us know that they are interested to bring this challenge. Our legal team is ready, so as soon as we hear from folks, we're ready to bring that challenge in a really short period of time. We've been working with KHJN, Planned Parenthood, EMW, taking phone calls, trying to get this number out to people who are in immediate need to ask if they are interested. We're widening that net a little bit here today, and last week, actually, at our RFP benefit, I shared this number more publicly. So we want people to share this hotline with folks who may be interested. We're not putting it up on a billboard. We're not posting it on social media because, of course, we know that our opposition may flood that hotline and make it unusable, right? So we ask that you don't post it on social media, but if you do have folks that may be interested, to share that information. So I'm going to end there. I want to thank you all for being in this space today. I think that I'm always really inspired to be in these types of spaces, to be in multiracial spaces where folks are really concerned and working on reproductive justice issues is extremely rare. It is rare, especially here in the state of Kentucky. So this is a very special and a unique space, a multi-generational space. This is the type of space that we need in order to address all of the challenges that we face here in the Commonwealth. So thanks to my colleagues, thanks to SisterSong, we are so glad for your all's partnership over the years and that you're going to have a larger footprint here in the Commonwealth. We'll get to work a lot more closely together. But this space, this type of gathering of people, this is what we need exponentially and many times over in order for us to actually have reproductive freedom here in the Commonwealth. So thank you all so much, and I'm going to pass it back to Dr. Robin.